Today, we're talking to Dr. Robert Bell. Dr. Bell is an orthopedic surgeon, a clinician scientist, a past fellow of Harvard University, and now the CEO of the University Health Network. The topic is the importance of healthcare as an economic driver. Ladies and gentlemen, Dr. Bell.
We tend to look at healthcare as being a cost center for the Canadian economy and for our society. We think that we have to pay money into healthcare in order to achieve care. And that is true. There's no question healthcare has a cost. I think we also need to look at our healthcare system, especially here in Toronto, as having potential for being a profit center. A couple of different ways that works. One is by the fact that research dollars flow into our hospital. Some of those are tax dollars contributed by Canadians, but some of those dollars are tax dollars contributed by Americans. We have NIH-funded programs here where people are being paid to do research by tax dollars contributed by Americans. We also have industry, international industry, supporting the research that's undertaken here. So certainly there are dollars flowing into our research enterprise to support work done by Canadians, dollars coming from outside the country. Crucially, the development of Mars and Mars innovation here at the corner of college and university really has changed the way we think about commercialization of our research discoveries. And, you know, there are two elements to that. One is, of course, we want to make a profit. We want to employ more Canadians. We want to plow those profits back into the funding of research. The other thing to remember is that if a discovery, if a product, if a new device, if a new resource is going to reach a patient, it has to have a channel to get there. And that channel needs to be driven by a company actually manufacturing the discovery and bringing it to patients. So it used to be that profit was a bit of a dirty word in our research community. No longer. The sophistication of our research community and understanding that commercialization is an inherent necessary part of what they do has transformed the way that we think about research, and I think Mars has had a lot to do with that. One of our thoracic surgeons we recruited from Tokyo. He came here originally to study with us how to do lung transplantations, found the city congenial, found that his family felt welcomed here, certainly felt stimulated by the work that was going on here. He had started off work with Olympus in Tokyo, and when he was recruited here, managed to bring with him both support and the interest of Olympus in developing a facility here where Olympus actually develops its thoracic, its lung imaging products here with us and helps to support the development of new instrumentation for our thoracic cancer patients, our lung cancer patients. There's a great example. We wouldn't have the connection with Olympus unless we were able to recruit people from around the world to come and work here. The focus of our research efforts here at University Health Network, and largely the focus of our philanthropy. Part of the reason why we are Canada's premier research hospital is that we raise over $130 million a year through our foundations to support our research efforts here. When you compare our health systems in Canada and the United States, I've worked in the American system, and there's some wonderful innovation that occurs as a result of their system, but there's no question. If you look at the average care within the American system, it's not as good as the Canadian system, and it's certainly a heck of a lot more expensive than the Canadian system. If you look at cancer outcomes, if you look at heart disease, if you look at a variety of different outcomes, we do every bit as well, if not better, than the best results achieved in American hospitals. And we do it at a cost of 10 or 11% of our GDP as opposed to 16 or 17% of our GDP. Our hospitals in Ontario are very cost effective. If you compare us to other provinces, there's actually about a $2 billion savings a year that Ontarians achieve compared to Alberta, compared to British Columbia, in the cost per capita of the Ontario hospital system.